Imagine you're sick. High fever, pounding headache, weakness spreading through your limbs. You call for the doctor. He arrives with his black bag, examines you briefly, then pulls out a sharp blade. "You have too much blood," he announces. "We must drain the excess to restore balance." Before you can protest, he's opened a vein in your arm. Blood flows into a bowl. You grow dizzy, pale, weaker. "Good," he says. "The treatment is working." This wasn't torture. This was medicine. For over 1,000 years, bloodletting was considered the single most important therapeutic technique in the physician's arsenal. And it was based on a fundamental misunderstanding of how the human body works. Let's open the vein of history and discover why medieval doctors believed draining your blood would save your life, and why it usually did the opposite. Medieval medicine was built on the theory of the four humors, inherited from ancient Greek physician Hippocrates and systematized by Galen in the Roman era. The theory stated that the human body contained four essential fluids: blood, phlegm, yellow bile, and black bile. Health meant these humors existed in perfect balance. Illness meant imbalance. Treatment required restoring equilibrium. Each humor corresponded to elements and qualities. Blood was hot and wet, associated with air. Phlegm was cold and wet, linked to water. Yellow bile was hot and dry, connected to fire. Black bile was cold and dry, tied to earth. Your temperament, personality, and health all depended on which humor dominated. Too much blood made you sanguine, cheerful but prone to fevers and inflammation. Excess phlegm made you phlegmatic, sluggish and prone to colds. This wasn't superstition to medieval doctors. It was science, inherited from the greatest medical authorities of antiquity. Galen's texts were treated as sacred. Questioning humoral theory was like questioning gravity. It was the foundation of all medical understanding. And if the theory said illness came from excess humor, the cure was obvious: remove the excess. Blood was considered the most abundant and most dangerous humor. It was literally life itself, but too much caused disaster. Fevers, headaches, inflammation, madness, all blamed on plethora, excessive blood. The solution? Phlebotomy, bloodletting. Open the vein and let the poison drain. Medieval doctors had an arsenal of bloodletting tools, each with specific purposes. The lancet was most common, a small, sharp blade designed to pierce veins cleanly. Doctors carried lancets in leather cases, keeping them sharp and ready. The cut had to be precise. Too shallow and blood wouldn't flow properly. Too deep and you risked severing arteries or causing dangerous hemorrhage. Fleams were spring-loaded devices that punched blades into veins with mechanical force. These were popular for veterinary bloodletting and sometimes used on humans when quick, deep cuts were needed. The mechanism ensured consistent depth and reduced the chance of the patient flinching away from the blade. Scarificators were brutal devices, small boxes containing multiple spring-loaded blades that simultaneously created several shallow cuts. These were used when widespread bleeding from skin surface was desired rather than deep venous flow. The parallel cuts created dramatic visual effect and allowed blood to seep from multiple wounds. But the most iconic bloodletting tool wasn't a blade at all. It was alive. Leeches. These segmented worms attached to skin with sucker mouths, made small incisions with tiny teeth, and secreted anticoagulants that kept blood flowing. Then they drank. A single leech could consume several times its body weight in blood before detaching, fat and satisfied. Leeches had advantages over cutting. They were precise, could be placed anywhere on the body, and the amount of blood loss was somewhat self-regulating. They were especially useful for delicate areas, near the eyes, inside the mouth, around genitals, where cutting was dangerous. Medieval doctors kept jars of leeches, stored in water, ready for use. Barbers and surgeons maintained leech supplies as standard equipment. Bloodletting didn't cure anything. It couldn't. The humoral theory was wrong. The body doesn't work through balancing four fluids. Removing blood doesn't treat infection, reduce inflammation, or cure disease. What bloodletting actually did was weaken patients. Blood carries oxygen. Remove blood, and oxygen delivery to tissues decreases. Patients become fatigued, dizzy, weak. For someone fighting infection, bloodletting removed white blood cells needed for immune response. For someone with fever, bloodletting temporarily lowered blood pressure, which might reduce fever sensation, but it didn't address underlying infection. In many cases, bloodletting probably hastened death. Patients already weakened by disease were pushed toward fatal collapse by deliberate blood loss. Yet because medieval doctors expected improvement, they interpreted any change as therapeutic. If the patient grew calm and quiet after bloodletting, it was because the treatment worked, not because they were slipping into shock and dying. Some patients survived despite bloodletting, not because of it. Their bodies recovered from illness while simultaneously recovering from iatrogenic blood loss. Doctors credited bloodletting for the cure, reinforcing the practice. Confirmation bias was overwhelming. When patients died, it was because disease was too advanced or treatment came too late, never because treatment itself was harmful. Beyond blood loss, bloodletting carried significant risks. Infection was constant danger. Lancets weren't sterilized. Doctors didn't understand germ theory. Blades moved from patient to patient, carrying bacteria. Cuts became infected. Simple bloodletting wounds turned into abscesses, cellulitis, and sepsis. Arteries were sometimes accidentally severed instead of veins. Arterial bleeding is rapid and dangerous, difficult to control. Patients could bleed out before help arrived. Even when controlled, arterial damage could cause permanent circulatory problems in affected limbs. Nerve damage occurred when cuts went too deep or were made in wrong locations. Patients lost sensation or motor control in hands or arms. Some damage was temporary, some was permanent. For workers who depended on manual labor, this could be economically devastating. Leeches carried their own risks. Occasionally they crawled into body cavities, mouths, noses, rectums, and attached internally where removal was difficult and dangerous. Leech bites sometimes bled for hours after the leech was removed due to anticoagulants in their saliva. Excessive leech application could cause as much dangerous blood loss as cutting. If bloodletting was harmful, why did it dominate medicine for over 1,000 years? Several factors created its resilience. First, authority. Galen was revered. His texts were translated, copied, and taught across Europe. Challenging Galen was challenging medical orthodoxy itself. University medical education drilled humoral theory into every student. Physicians built their entire understanding of disease on this foundation. Second, apparent results. Bloodletting produced visible, immediate effects. Patients calmed down. Fevers temporarily dropped. Inflammation seemed to reduce. These were actually signs of weakening, but they looked like improvement. Doctors saw what they expected to see. Third, lack of alternatives. Medieval medicine had limited effective treatments. For many conditions, doctors could offer little besides bloodletting, herbal remedies of questionable efficacy, and prayer. Bloodletting at least felt like doing something. It was active intervention, giving both doctor and patient sense of control. Fourth, economic incentives. Bloodletting was profitable. Barber surgeons charged for the service. Physicians collected fees for consultations prescribing it. Leech merchants sold their wares. An entire economy built around bloodletting had vested interest in its continuation. Not everyone accepted bloodletting uncritically. Some medieval physicians questioned excessive use. They noted that weak patients often died after bloodletting and recommended caution. A few suggested that bloodletting was overused and possibly harmful in many cases. Outside medical establishment, folk healers sometimes avoided bloodletting, relying instead on herbal treatments, dietary changes, and rest. Common people occasionally resisted doctors' recommendations to bleed, trusting instinct that losing blood while sick seemed counterproductive. But these dissenting voices were marginal. Medical consensus remained firmly pro-bloodletting. Skeptics were dismissed as ignorant or dangerously innovative. The weight of tradition, authority, and institutional medicine crushed opposition. Medieval bloodletting stands as monument to medicine's capacity for systematic, well-intentioned harm. Doctors genuinely believed they were healing. They followed established science. They used the best knowledge available. And they were catastrophically wrong. Finally, bloodletting reminds us that good intentions don't guarantee good outcomes. Medieval doctors weren't villains. They wanted to heal. But wanting to heal isn't enough. We need accurate understanding and honest assessment of results. Compassion without knowledge is dangerous. Medieval bloodletting killed millions while claiming to cure them. It's easy to judge from our position of superior knowledge. But the real question is, what are we doing now, with equal confidence, that future generations will view with the same horror we feel, looking back at bloodletting's 1,000-year reign?